Welcome everyone to the 2020-21 Sizzling Summer Series sponsored by the UNMC College of Public Health, Office of Public Health Practice. We are grateful for our partners on this series, the Midwestern Public Health Training Center, Wichita State University, and the College of Public Health and Social Justice at St. Louis University. My name is Laura Vinson. I'm the Service Learning Programs Manager in the Office of Public Health Practice. My colleagues and I in the office will be your hosts for this series. This summer series is focused on exploring what it will take to become an anti-racist public health workforce and public health system. Over the months of June, July, and August, we will host the 5-part series. Today is session number 2 in our series, and we will focus on micro and macroaggressions and implicit bias. Before I turn it over to our speaker, a few logistics. Because of the number of participants on our call today, we ask that you keep yourself muted. If you do have questions for our speaker, I will be monitoring the chat throughout the session. If you experience any technical difficulties throughout the call, please send me a private chat message for support. We are recording today's webinar, and the slides for today will also be posted. Both the recordings and the slides will be made available online following the call on both the UNMC Office of Public Health Practice and Midwestern Public Health Training Center websites. We will have the recording from session number 1 online in the next week, and we will send an email with a link once it has been officially posted. A link to the evaluation will follow this call. Evaluation data will be used to inform the content for the next call in the series, for quality improvement on the series overall, and for reporting purposes to our funders. We thank you in advance for your feedback. With that, it is my pleasure to introduce to you our speaker for this session, Alicia Sanchez. Alicia is a passionate advocate and social entrepreneur committed to guiding leaders and organizations to foster a culture of inclusion. She currently serves as an Assistant Dean of Students and the Director of the Office of Diversity and Inclusion at Wichita State University. Her commitment to diversity and inclusion efforts in academia, business, and community is evident by how she spends her time. Alicia shares her knowledge and expertise as a governor-appointed commissioner for the Kansas Human Rights Commission and the Kansas Credit Union Council. She also serves as a City of Wichita District 2 Advisory Board member and a member of several nonprofit boards. Further, Alicia is a doctoral student in the Higher Education Leadership Program at Wichita State. And most importantly, she is a proud mom to Declan. Alicia, we welcome you and thank you for joining us here as we explore what it will really take to become an anti-racist public health system. Over to you.
Wonderful. Well, thank you, Laura, for the introduction, and good afternoon, everyone, or good morning, depending on the time zone. I don't know where everyone is located. I'm really excited to be able to join you today and talk about this topic. So we're going to delve in. I'm not going to lie. We have a lot of information to cover. And this is really an opportunity for us to engage and take a deeper dive on these. So anytime our office, the Office of Diversity and Inclusion, we conduct any sort of workshop, training, facilitated discussion, we start with conversation expectations. And so some of you might be familiar. Certainly you can borrow these as well and utilize them if you are facilitating similar conversations, difficult conversations, courageous conversations. But I asked during our time today that you be present and respectful in the space. Again, obviously being virtual makes it a little challenging to engage with one another, but right, you might be an expert or you might be a novice in this topic. And so we want to make sure that we're engaging respectfully. Lean in. We have 2 taglines in our office. One, we're the home away from home. The other is to lean into discomfort. Again, in that space of being uncomfortable, that's where we're going to really learn and grow. Land the plane. So use the language that you have, right? So I'm going to be your Delta flight attendant, my bias towards that airline, right? And so I want you to be able to, whatever your thoughts or comments are, say it with the language that you have and get that statement out. And then I certainly will help correct or provide maybe some alternative language as well. Assume good intent, right? We're in a time where we're quick to call people homophobic, racist, sexist, all the isms and phobias. So we want to make sure we're assuming good intent. And of course, freedom of speech is not freedom from consequences. We may say something on here. We have individuals who might be colleagues, you might work together in different capacities. But we want to make sure that, we recognize that what we say may have some consequences. Stories stay, lessons leave. And what we mean by that, right? We might share, there'll be an opportunity to do some breakout rooms throughout the afternoon, and you might say a specific name, organization. We don't want you to take those specifics out in those stories. We want the concepts and overall knowledge to leave and for you to share. And then be respectful and agree to disagree. So that is what we're going to set up this afternoon. And then before we delve in, I just want to do just a brief mindfulness activity with you, right? If you're like me, you were probably running from meeting to meeting today, right? My day started off with my 8-year-old Declan forgetting his lunch, so we had to go back home. There was a chain reaction. And so if you're sitting at your desk, I would say, plant your feet firmly on the ground, take an opportunity to take a few deep breaths and let them out slowly, right? We want to make sure that we're here, we're present. If you're like me, you probably have your cell phone next to you, maybe a laptop in addition to your desktop, and just want you to be able to be present with me this afternoon. So just take a deep breath and feel free to close your eyes, breathe in and breathe out. We'll do one more. Take a deep breath in and breathe out. So that certainly mindfulness activities they've been around for a long time. I think in the last year, there's been a resurgence of those. And so whatever it takes for you to get present in a space, I would welcome the opportunity for you to do that as you go through this afternoon. So I want to start with some common language. Some of these definitions you may be familiar with. I know last week or the last session you talked about identities, and some of these things may have come up. You might be familiar with them, but so we're working from the same language. So when we think about equality, it's about giving everyone the exact same resources. Equity involves distributing resources based on the needs of the recipient. And that's really about a large part of our conversation is thinking about how do we practice healthcare and engage with our peers, with patients, with students, right? There's a diverse group of individuals, but really thinking about how do we make sure that we acknowledge that we are all not starting at the same place, but really being able to move towards equity and giving resources based on the needs of the individuals. Prejudice is outward expression of negative attitudes towards different social groups. Stereotypes, again, oversimplified, fixed and widely held beliefs about an entire group of people. They're not always accurate, so I think that's an important piece of this and can lead to judgment when applied to individuals within that group, and so really being mindful of those terminologies. Institutional racism, also known as systemic racism, structural racism, a form of racism that's embedded in normal practices within society. So when we really think about discrimination in our criminal justice system, within healthcare, housing, the political system, education, it really shows up in lots of different things when we really think about the historical perspective of systemic issues. Bias, which we're going to delve into quite a bit today, but it's the tendency to favor one group over another. And so biases can be favorable or unfavorable. I think that's the important thing, because oftentimes people hear the word bias and they tense up or they have some sort of a reaction in a negative way. And right, we all have bias. Again, it could be positive or negative, and we'll talk a little bit more about that. It might be unconscious. So again, that belief bias that we're unaware of, which happens outside of our control, or when we think about implicit bias, again, in the same way, but really kind of questions, how we're becoming increasingly aware of them. And then we'll delve in a little bit and talk about conscious bias as well this afternoon. And so when we think about bias, implicit bias, it's nothing more than our evaluations of our beliefs. Again, like I said, positive or negative, and exist without us even realizing it oftentimes. And so there's evidence that implicit bias can really impact our decisions, our perceptions, our behavior. And when we think about it, really when we're working within public health, health outcomes, across the board within healthcare and medicine, right, this can specifically show up and really operate outside of our conscious awareness, which there are some significant implications around that. And so it's important to make sure that we think about implicit bias. It can rely on other associations that we form over time. When we think about, how we're socialized, a lot of our associations and our implicit bias stem from, how we were raised. The media certainly plays a role in that, not to blame media or journalism by any means. But again, thinking about our backgrounds, our experiences, the lens, our identities, all of those different things really shape the associations that we might have. and how we internalize messages, and certainly how that might show up when we think about care within healthcare specifically. So when we think about implicit bias in action, right, what does it mean to have thoughts and associations that we're aware of? So you'll see on this screen, I have 3 blanks there, right? Night Ann, Black Ann, Young Ann. And so you don't have to unmute, but I want you to fill in those blanks, right? When you think of night, and then you blank, Black Ann, Young Ann, and certainly you could feel free to utilize the chat to fill in what you think those gaps are. What goes in the blank when you think about this? So not a hard exercise. And so, yep, so I see quite a bit quickly coming in. Yeah, right, night and day. Let me see here. Night and day, black and white, young and old. And right, that's just that association that we're thinking of. And so, right, it wasn't a difficult exercise by any means, but right, it's just the power of our cognition and how lightning fast our associations are. And so what happens is it's possible to have associations that are shared amongst various groups, right? There were several of you that typed in and said, very similar answers or the exact same answers. And we usually refer to this, right, as our norms or potential stereotypes. And so it's important to just kind of show you how your mind works. We're going to go through another exercise here that really speaks to the question of why implicit bias matters, right? Why are we talking about this? And so you'll see on the screen, and I apologize for any individuals who might be colorblind. I have some words on the screen, and you'll see 2 columns here. And when prompted, you can stay muted. I want you to read the color, right? Say the color of each of the words out loud to yourself. And it just as this exercise. So don't read the word. I want you to read the color of the word and say that, okay? So I'll give you a couple of seconds to practice that activity. Great. So now I'm going to give you another set of words. And again, just say the color of the word and don't read the word, okay? I know that yellow makes it a little challenging to see there on the screen with the other yellow. So, right, this assessment is known as the Stroop task, right? It's a sociological task, looks at the dynamics that are automatic, right? So for some of us in the first set of words, it may have been really easy, like our implicit way that we're thinking, right? We were able to read the words, there was no problem, we're very quick to do it, but then our automatic inclination to read the words the second time may have taken us a little bit of time, right, to think about what we're actually seeing. And this is why implicit bias matters, right? When we really think about it, we give ourselves rational and we're logical adults. But again, our thoughts are processing unconsciously without our intention, without our control. So again, these implicit processes, when activated, can sometimes derail or even our most sincere intentions, right? So intent versus impact, we'll talk about some more. Certainly if you're like me, right, anyone ever just gotten in the car, driven home, not even thinking about it, but instead you drive somewhere else or you just don't even know how you got home, right? That's implicit, that's your unconscious bias working at the same time, right? We get in, I don't know how many times I'll be driving home and I actually end up at Wichita State, which it's like, oh no, that's not my home. So this is just how our mind works. So thank you for participating in those activities. And so I'm certainly no neurosurgeon or brain scientist, but certainly you want to show all the pieces of our brain and how they're at work and how they're at play when we think about bias. Right? Because all of these are working in tangent for us to be able to function. You have your amygdala, which is the processing power, like that fight, flight, or freeze. Like our earliest people had to decide, do I hug the bear or do I run away from the bear? Do I eat the berry or is it poisonous? And so all of these things are at play. You have your hippocampus, that forms links in the brain, and information and memories are processed. Your temporal lobe integrates sounds and words. Your medial cortex, right, processes empathy, emotional responses, and rational thoughts. And so when all of these things are at play, there's been research that shows that on average, we can process 11 million pieces of information unconsciously. But when we're conscious, we can only process about 40 to 50. And I feel like some days for me, it's about 20 pieces of information. And then when we think about processing, stimuli, right, between 5 and 9 stimuli is all we can really process at one time. So when we think about like a phone number, right, you can remember so many digits, and then the last couple of digits, oftentimes we can't remember. So again, it's just thinking about how our brain processes and the science really behind implicit bias. So I have a video that will delve in a little bit deeper about implicit bias. So I'll go ahead and cue it up, and hopefully everyone can hear my sound okay.
Implicit bias.
Implicit bias.
Implicit bias.
2016 was the year that implicit bias went somewhat mainstream.
Yeah, so when Hillary Clinton mentioned implicit bias in the debates, our phones started blowing up, all our friends started emailing us about it.
But what is implicit bias? Implicit biases are basically thought processes that happen without you even knowing it. Little mental shortcuts that hold judgments you might not agree with. And sometimes those shortcuts are based on race. First, some clarity. Saying someone has an implicit bias is different from calling someone a racist.
The word racist is a highly loaded term, right, here in American society. A lot of times when people are using it, they're thinking of the kind of old-fashioned Ku Klux Klan style racist.
But implicit bias isn't anywhere near that, explicit.
Implicit bias is something that comes out of ordinary mental functioning, out of how the mind normally works.
We've all grown up in a culture with media images, news images, conversations we heard at home, our education. Think of that as a fog we've been breathing our whole life. We'd never even realized it, what we were taking in.
And that fog causes associations that lead to biases.
I somehow know that if you say peanut butter, I'm going to say jelly. That's an association that's been ingrained in me because throughout my life, peanut butter and jelly are together. And in many forms of media, there's an overrepresentation of Black men and violent crime being paired together.
And because of that, I actually deep down inside have been taught that Black men are violent and aggressive and not to be trusted, that they're criminals, that they're thugs.
With all those associations, I'm not trying to let us off the hook, but in some ways, none of us stood a chance.
Starting today, we'll post a video a day dealing with one challenge of understanding.
So feel free to unmute if we want, or if you want to utilize the chat as well. Thoughts on the video or what we've talked about so far? Just want to do a quick check-in.
Hi, sorry, I'm kind of a shy person. It's just, like, I don't know if any of you have read, like, the new Jim Crow and stuff like that, and, like, read up on, like, the piece of the pie. It's just, to me, it's not, like, funny, but it's just, like, ironic that Black men are thought of as violent because, like, if you look at the statistics, white men are so much more to be like, Black men are more likely to be like arrested and like committed with a crime, but it's white men are like I don't know what I'm trying to say. It's just like we assume that Black men are so bad, but they're not. It's just like there's quotas that don't exist. But, like, if you've watched documentaries, quotas do exist, and, like, they go after the people in the Bronx and, like, things like that. And so I'm sorry, like, I don't know what I'm trying to get on this ramble on, but it's just, like, so for me, my implicit bias is for white men, which is, like, I'm sorry, I'm white, and I'm, like, my implicit bias is white men. So I'm just, like, that's really weird and, like, kind of, like, messed up, but I'm, like, I see a white man, and I'm, like, you suck. And that's like a terrible thing to say, but I'm like, it's true. And I'm like, and I work public health, so I probably like shouldn't like have biases like that. But sorry, that was my ramble.
No, thank you.
Oh, I am muted, but I did not intend to say anything.
Oh,
So
okay.
much of this was great. I was in high school in the 70s. Okay. So way back then I was taught to pay attention to any mental stimuli from TV, from music. I muted Michael Jackson's music so that I could watch his movements and get the messages from his movements, et cetera, et cetera. So I love this presentation.
Great, thank you. If you want to go ahead and unmute.
Oh, okay. I was just going off of the video presentation, and something that I thought of that happened to me not too long ago is I was in a predominantly African-American part of the city. My hometown is also St. Louis, Missouri. And if you don't know, St. Louis is one of the metropolitan areas in the United States that has the highest percentage of African-American people in it. But I was in this store in Nebraska, which is where I'm at right now. I'm in Omaha, Nebraska. And right before I went into the store, I was seeing a lot of different African-American males and females walking into the store. And I immediately got nervous. And then I sat in my car for a second and I kind of sat to myself and said to myself, why are you afraid of people that look like you? And so when the African-American man just got on this presentation and said that he has been socially trained and indoctrinated to believe that people that look like him are implicitly bad, are inherently bad versus the people that historically have been, there's data to prove that they have more of a propensity towards violence than the people that we are trained to believe have the propensity towards violence. But I was sitting there in my car and in that space, in that moment, and I was angry and I was disappointed with myself because why should I believe that people that look like me would want to do me harm, but want to believe that people that don't look like me do not want to do me harm? And I'm not saying that to say that people that don't look like me want to do me harm, but that should never be the first place that my mind should go. And I was angry and disappointed in myself. And I had a reckoning with my implicit bias in that moment before I got out of that car. And I said, never again will I be afraid to walk in a space where people that look like me are the predominant and feel that fear. So we have to consciously fight the implicit bias that because we're all adults on this phone call, regardless of how long we've been adults, is not the point I'm trying to make today. But I believe we have to consciously fight and renew our minds and renew our consciousness to fight that implicit bias that we have been taught. And if you go back and you sit still and you look at commercials and television shows, regardless whether you stream or you're looking at network, you still have to fight those things. And some days it's hard, which is why I watch a lot of cooking shows and a lot of Animal Planet, because sometimes it's easier just to watch a lion eat an antelope because you know that's naturally. So, and I'm serious, I'm joking, but I'm serious because naturally that's supposed to happen. So that gave my mind a break from thinking the screen is trying to put something in my brain that is not supposed to happen in nature. And so I'm rambling now. You ain't the only one that gets to do it. So you have friends in the rambling department. That would be me. But I just think that that's something that, and I just purchased a book. I haven't read it. I just got it in the mail yesterday about the fatigue that the African American population experiences because of implicit bias, because of racism, because of the constant fight, internal and external, to reckon with the society that we live in present day. And goodness knows it ain't easy. And some days you just want to turn everything off and take a nap.
Yeah. Thank you. We'll keep moving forward, right? And I think, when you think about, for those that were able to attend the identity session, I'm assuming, I was not able to participate in that, that there may have been some discussion around intersecting identities, right? When we think about implicit bias, oftentimes we are quick to associate it to one identity of someone. We're complex individuals, right? Like for me, I identify as a Latina. So it's my ethnicity and my gender that are connected together. And that's the world that I see. And as I walk into a space, that's how I know the world is looking at me. And so, right, it's sometimes difficult. And so when he was talking about, feeling unsafe, and I'm paraphrasing that, maybe using your exact words, right? Was it because of racial identity? Was it because of a gender difference? So there's all these other things that are at play, but I think the most important thing is to really be conscious of our bias, right? And really talk and think through, like, where is that stemming from? So a lot of the maybe internal dialogue that you were having is spot on to what we have to do to work through our bias. So I appreciate all the comments that were shared with this afternoon. So. All right, keep moving along here. So implicit bias has friends, right? We think about, there are hundreds of different types of bias, and certainly we aren't able to cover them all this afternoon. But confirmation bias, affinity bias, in-group favoritism, attribution error are just some that I think really resonated when I was thinking about this topic in this presentation, and really thinking about, how we're interacting and how we're engaging when we think about seeking out information, what we know to be true, right? You might know someone, or you might be, right, you only watch Fox News, you only watch CNN, you only listen to NPR, right? And once your information is confirmed, you have your information, right? You're not going to seek out anything to be different, because what you believe to be true has been verified. Affinity bias and in-group favoritism are very similar, right? It's the unconscious tendency to get along with others who are like us. And so we have to be really careful when we think about how we're engaging with others, even really thinking about that within healthcare. If you're interacting with patients and the public and engaging, right, you might have a tendency to navigate to one group, or you might be providing resources and not even realize that that's happening. And in-group favoritism, right, goes right along that. You want to favor members in a group. We think about our in-group and out-group dynamics, all connect together. And so we have to be very mindful of how we're evaluating, how we're delving out resources, the hiring process, promotions. There are so many different ways where all these different biases are populating and coming up. So want to provide you an opportunity to think through bias. And so we're going to set you up in breakout rooms. Laura has already done that. We're going to give our breakout rooms about 8 minutes for you to talk about these questions. And I'm going to, these questions. And so we want you to think about, how has bias shown up in your work? What have you done to combat bias showing up in your work? And so you'll probably be in groups of about 5 to 6 individuals. Want you to engage in these questions, and then when we come back, you can either identify someone before you come back to share. We certainly won't get through every group, but want to hear from at least 2 groups and individuals that maybe haven't spoken yet, to share your insights with the larger group. So we'll go ahead and open breakout rooms. I think, Laura, is that on your end there? So we'll go ahead and open them up. And we'll give you 8 minutes. And so, Laura, I'll turn it over to you to go ahead and open the rooms, and then we'll see everybody back in just a little bit. All righty, it looks like everybody's coming back from the breakout rooms. I know 8 minutes sounds like a long time, but it goes so fast. We'll go ahead and keep moving. But any group want to share out some insights from their large group or from their small group discussion?
I'll share. So we had a nice spread of folks in our room. So we had someone who worked in university admissions and talked about how they are blinding the interviewers to the applicant grades. And so when they're having interviews with the students, they're just in scoring them, responding to the students' answers to the questions and not looking at grades. So that was interesting. And then we had Pamela express that as a Black person, she has like an internal paradigm for implicit bias and has to kind of check herself. So if the example that she gave is she's walking through a store and she notices someone following her, that is her perception when maybe they're just walking to lunch, for example. And then we had Emily from a local health department saying that when they're looking at data, in homicide data, there is an assumption going into the data that the perpetrators are going to be Black males in general. And so having to overcome these things. But yeah, it was good but short discussion.
Great, thank you. It sounds like it was a good, like you said, right? You described it perfectly, right? So I appreciate that. Let's see.
Now, I didn't take extensive notes, but I'm going to do this based off memory. So, of course, you have, I'll begin with my experience, just being the aggressor because of the color of my skin or just being passionate, and someone who doesn't look like me may be considered less aggressive, or I'm upset when I'm expressing a strong opinion about something. Something else that was mentioned is ageism in the workplace, having to, be a leader and having constituents who are older than you and don't want to work with you or report to you because they feel you are younger or rather inexperienced. And then there was another gentleman on who he did not experience any biases, being an older white gentleman. And so he didn't have the same experiences as us. And then there was another experience. She, just being a person of color, always having to check yourself, or, everyone looks at you as not the gold coin, but okay, you have the answer to this racial bias. You have the solution. You are the solution, the token. That's what I'm talking about. The trophy. Yes, the token Black person. So those were the different subjects brought up in our group.
Yeah, no, excellent. Well, thank you all for sharing. Certainly, right? You'll hear me say, right, we all have bias, and part of this discussion is just acknowledging some of those things. And so sounds like there was some good discussion. I know for the sake of time, we can't hear from every group, but feel free, though, to continue to utilize the chat to share any other things that may have come up that you want to share with the larger group. All righty. So, right, when we think about implicit bias and structural racism, right, structural racism plays a huge role in how and determines how people experience the world around them, right? So, there's several different examples that I have up here. When we think about the historic perspective, right, history was built where not all members were included. When you think about what is taught in history books, we do an activity, the 400 years timeline, that talks about what has happened. And there's so many things that are not included on that timeline, right? When we think about, the Civil Rights Act, Loving versus Virginia, which is a case with for interracial marriages, right? The anniversary was just recently, right? Looking at biracial, two or more races, being able for people to self-identify in that way. And so we have to be really mindful of how that structural racism and the history all ties into our implicit bias. And a lot of what we heard already all tie into that, right? Our society is still unfortunately segregated. When we think about opportunities to interact with people who are different than us, it's important for us to understand that we all have different experiences and we're all not alike. And so how do we really get proximate with one another? I talked about socialization and thinking again that we all grow up differently. We all have our lens, our walks of life, but being able to think about how do we help support and uplift our community when we think about how we all come together. And circumstances are not solely based on, an individual, right? Oftentimes I hear people say, well, so-and-so, if they just pulled themselves up by their bootstraps. We have to acknowledge that that is not true for everyone. There are systems in place. There are policies, there are structural issues that were intentionally created that prevent people to move beyond their circumstances. And so we have to acknowledge that. We have to focus on the inequalities and really look at things through the lens of racial equity. So again, really acknowledging that equity piece and how we're applying it to all of the inequalities that do exist. And a lot of our conversation has been around racial identity, but we heard about ageism and sexism and gender. There's so many other things, especially when we think about power and inequality. We're not talking about power and privilege and oppression today, but certainly all of those things connect to this topic, certainly, because when we think about power, right, if you're in a situation and in some sort of a relationship, we'll say, that certainly it's difficult to say how you might really feel or how you might promote equity when someone else might have the power or the control to guide or determine how the information is shared or how it is utilized. And, we want to speak up, but oftentimes there are circumstances that prevent us from that. And then it again impacts this cycle of continued structural racism and institutional racism. And then we have to think about quality and underrepresented people, right? Those things should be synonymous with one another. And so how do we really think about, right, if there's something that we're putting in place for one community, how does it really uplift all communities? But being mindful that how we execute and deploy that might look very different based on those specific communities. And then again, we have to be mindful to how do we employ holistic policies, right? There's a lack of holistic policies that are really making it difficult for people to uplift an entire community and not just really focusing on a sole individual. There are times when we have to focus on the individual, but we have to acknowledge that we have to move on. Once we acknowledge those implicit bias, the structural racism, how do we move forward to break down those barriers? So when we think about implicit bias and health outcomes, there's a number of different ways where implicit bias shows up. When we think about, medical school admissions, I heard someone that worked in the admissions office, right? The process in which we're selecting students to go into medicine. When we think about the diverse medical workforce, right? All of these things tied together, right? If we can't diversify the students who are going to med school, we can't necessarily diversify the practitioners that are working in medicine. Certainly there are opportunities, and it's not just being a doctor or a nurse or a PA, and but there are all positions at all different levels. But we have to make sure that we're looking at the diversification through every level, right? When we think about oftentimes the lack of representation for women in leadership positions within healthcare, right? Across the board, for a lot of different industries, but in healthcare, we still see, right, white cis men that are in those roles. And so we have to be very mindful when we look at promotion and growth. And certainly when we think about how it affects patient care, right? It's going to reduce the quality of care if we have implicit bias. We can dismiss symptoms or things will go untreated. We might misdiagnose, we might undiagnose, we might provide the incorrect prescriptions or medicines that someone needs. And all of these things are at play, right? Like all of these different identities have biases. And so we have to be very mindful. We think about in med school, there's the vignettes that the students will go through. And again, that is great because we want our students to be able to know that if they see a young Black African-American child with bone pain, that might be connected to sickle cell disease, right? If we see a white child with recurrent respiratory infections, they might have cystic fibrosis. So learning these associations is very helpful. And right, while it may be true for many of the prevalence test rates and things like that, but we can't apply that assumption to everyone, right? If we think, oh, okay, it's a young Black child, African-American child, it must be sickle cell. then we rule out everything else, right? Our bias coming in. And so all of these other things that I've identified will impact the care that that one patient gets, right? It's helpful to know and be cognizant and associate, but it's when we stop looking at our patient or the individual as a person. You think back to HIV pandemic, right? There was a lot of association with white gay men. And so what happened was then you had, a lack of acknowledgement or recognition of the disease when it came to women, to children, the heterosexual men, blood donor recipients. So it was just an assumption that it couldn't leave that specific community. And so now what we're seeing years later is because there was such a low reported rate within communities of color and lack of representation or lack of recognition, right now we're seeing that epidemic impacting communities of color. And so we have to be very mindful. There's been a research that has been done around the elderly, when they're 85 or older, they have the second highest rate of suicide ideation. And so if we're dismissing them and thinking that's not necessarily the case, and our bias comes in when it comes to our elderly patients, that's certainly, again, not helping how we're providing holistic care. We did a training, I did a workshop with a group of physicians, and we talked about how oftentimes their bias might show up if someone doesn't have health care, they're uninsured or underinsured, but they have an iPhone, they have nice clothes, they even acknowledge, like, I might even see them, pull up and they have a brand new car, right? But they don't have insurance. So, right, they're making assumptions on all of these things. Well, they have all these things, right? When it's their role to certainly take care of the patient. And so socioeconomic status, our gender and sexuality, our disability oftentimes even doesn't even come up. And when we even look at numbers and data around healthcare professionals that have a disability, that number is even reduced. And so really thinking about how all of these things, the representation or the lack thereof, is impacted. So, and this is looking more around that implicit and conscious bias. But when we think back, right, a very specific and unfortunate situation around conscious bias can manifest within the medical field. And so an example I'll share, a pretty notable one, is with the Tuskegee syphilis study, which Black men were targeted to determine the effects of untreated syphilis. And so that study certainly demonstrated conscious bias. And that it's continued to have long-lasting effects. And so we have to be very mindful of that it does exist, that conscious bias does exist and show up. And so tackling unconscious bias really involves being willing to alter our behavior regardless of what our intent is and when the impact bias is either conscious or unconscious. So being very cognizant of those things certainly is all going to play about how we can help support and work to reduce or de-bias and implicit bias. So want to keep moving along and talk about microaggressions. So you may be familiar with this term. I have a couple of videos that we're going to delve into here in just a second. But what I want you to do is to take an opportunity to reflect. And due to time, we won't share with the larger group, but I'll just have you think of a time when someone said something about an aspect of your identity which you felt was intentionally or unintentionally dismissive, insulting, or demeaning, right? So getting a little heavier, a little bit deeper, but I want you to think about how did it make you feel? What impact did the comment have on you and your relationship with the person? And so as we go through, we'll have an opportunity for you to go into breakout rooms again and process through and discuss around microaggressions. So I have another video that I'm going to queue up. And as you're watching this video, it's about 2 minutes long. I want you to think about how becoming more aware of microaggressions, what can becoming more aware of microaggressions do for you as a healthcare leader? So when you think about that. This video is from Wisconsin Technical Community College, so it does have more of a student, faculty, staff component, but certainly I think in any setting it is applicable. And so I will go ahead and queue it up.
You did really well on the skills checkoff today. I was pleasantly surprised.
Since I was a kid, I've always known I've wanted to do this.
Consider a time you've witnessed an interaction that left you feeling uncomfortable because it implied that someone or a group wasn't capable or expected to be successful. This interaction is called a microaggression. Microaggression is a term used to describe remarks or actions that imply negative associations and insults toward an individual or group. These are often directed at members of historically marginalized groups. People are often unaware that the impact of their words and actions can have such harmful consequences. This video is part 1 of a 2-part series designed to empower you to notice and interrupt microaggressions. Every microaggression students and staff experience adds to their load. One unintentional comment may seem insignificant, but these comments and experiences can get very heavy. By creating a better understanding of microaggressions and how to stop them, WTCS faculty, staff, and students will create a more inclusive and safer learning environment for all. So, how can you help address microaggression when you see it happening? When you notice microaggressions occurring, interrupt the situation. You could 1. Ask questions to get at any underlying assumptions.
Thanks. Why did that surprise you?
2. Acknowledge what happened to the person affected.
I heard that comment and it didn't feel right.
3. Be an active bystander and explain to the person saying or behaving in a harmful way why their actions had a negative impact, even if unintentional.
You did really well on the skills checkoff today. I knew you would.
Addressing microaggression is an ongoing process. You can start right where you are today.
So in the chat, if you want to put in your response to the question about what can becoming more self-aware of microaggressions do for you as a healthcare leader or as a leader in whichever field, because I know we have a lot of different individuals and industries represented. So would love to see some of those responses. We're going to keep moving, and I'm going to show you part 2 of our microaggressions video here.
In video 1, we defined microaggression and provided 3 strategies for interrupting them when they come up. Ask questions to get at any underlying assumptions. Acknowledge what happened to the person affected. Be an active bystander and explain to the person saying or behaving in a harmful way why their actions had a negative impact, even if unintentional. Microaggressions can be subtle and occur despite our best intentions. How do we know if we are saying and doing things that are harmful to others? In this video, we offer reflection questions to help us examine our own participation in microaggressions. What was my intention? What assumptions are behind what I said or did? What was the impact?
Where are you from?
From right around here.
Yep, me too. But where are you really from?
Me? I was born and grew up here, in Wisconsin. The intention of this question might be to connect with someone new, but the underlying assumption is that this person doesn't look like they are from here, and the impact is they may feel othered or question if they belong. Microaggressions can invalidate or exotify someone's identity, or imply stereotypical expectations, even when intended to be complimentary. Have you heard or even said any of these common microaggressions? What might the intentions, assumptions, and impacts be of each? Wow, you're so articulate. I feel so OCD today. Don't make him angry. He's a veteran. I can't say your name. I'll just call you Jay. Can I touch your hair? You want me to say they, them, or theirs when you're clearly a woman? Do you need a translator? You'd be prettier if you smiled more. If you're unsure why some of these statements can be considered microaggressions, use this as an opportunity to self-educate. What other microaggressions have you witnessed, experienced, or participated in? Noticing and addressing microaggressions is an ongoing process. By using these strategies and reflection questions, we can create a more inclusive environment for everyone.
All righty. So would love to hear maybe a couple of responses from the first video, and then thinking about this other question around self-reflection questions. How could they help someone when responding to microaggressions? And I know we're giving you a quick version. I usually do microaggressions in 2 hours and not just a 45-minute portion. But any thoughts on microaggressions in the 2 videos?
When we did our first breakout group, we talked about how public health does not exist in a vacuum and how important it is to work with communities, particularly communities that have experienced trauma or abuse in the past. And so I think it's very important that when we recognize these microaggressions we may not even be aware of, because we need to establish trust with patients so that they will, and community leaders, even if we genuinely want to work with them, we may end up shutting them down and destroying those relationships without even realizing it. So I think by becoming aware of this, we will only strengthen our partnership and work better together.
Great. Other thoughts, maybe from another voice that we haven't heard from yet this afternoon? No, that's okay. We'll keep things moving along and talk about microaggressions a little bit more. So when we think about microaggressions, despite micro, right, when we think about microaggressions, micro means that person-to-person interaction between someone. And then when we think about macroaggressions, it's looking at the systemic issues, right? When those isms, those phobias, those types of things. When we think about institutional or systemic racism, sexism, those are the types of things when we think about the word macro. And so I know I really focus on the micro because it's that person to person. Certainly, if we could delve in and tackle macro, I'd work myself out of a job, which wouldn't be a bad thing when you think about it. But when we think about microaggressions, right, it doesn't mean they're small. They occur frequently. Oftentimes, there's a quote that has been utilized that microaggressions are death by 1,000 paper cuts, right? Some people experience microaggressions over and over and over again. And so how we are able to acknowledge and respond is important, because oftentimes, because they can be so subtle, individuals don't even realize that they're committing microaggressions and go unaddressed. And so someone will continue to use language which they don't realize is perhaps inappropriate, and they don't realize that. And so over time, microaggressions can have some significant long-term effects. So we look at self-esteem, we look at anger and frustration, all of these different things, right? Your workplace performance, increased health problems. There's been a significant amount of research that correlates, coronary issues, right? Heart disease, high blood pressure, all of these different things. And these are issues and things that are occurring in many communities of color. So then you throw and you add the impact of microaggressions, and that certainly is enhancing those things. And so we have to be very mindful. There was a study that I came across around American Indian, Alaskan Native community, where they had higher rates of medical problems, right? Again, looking at cardiovascular disease, mental health issues, diabetes, and the National Healthcare Quality and Disparities Report reported that they were receiving worse healthcare than white Americans, approximately 1 out of 3 of the qualifying care indicators. And so when they look at this study, over 30% of the patients reported experiencing microaggressions and interactions with medical providers, and this correlated with their self-reported history of heart attacks, depression symptoms, and prior year hospitalizations. And so when we think about microaggressions, right, it's not just that it hurts somebody's feelings. There is truly some research around how it impacts them holistically in their biology. And so again, that's just an example of the importance of having a good provider-patient relationship. And so, right, for me, I think I have a good relationship with my healthcare providers. And so when I found the right internal medicine doctor for me, I was more willing to follow the regimen, to follow the prescriptions and their medical advice and their treatment protocols, because I had trust. And so many individuals, when there isn't trust and when they have the implicit bias or the microaggressions that are impacting them, they can damage that experience, and someone will then not be not want to come to a visit. They're not going to want to follow the treatment protocol. And so those unconscious bias and those self-reflection activities that we talked about, all of those things, we have to be much more cognizant in order to achieve high quality and culturally sensitive care. I think that those are the things when we think about microaggressions and their impact and how we're mindful of those things. So I want to provide you some tips. Perhaps you've experienced microaggressions, someone has experienced, you have been a microaggressor, you've been a bystander, but want to provide you some tips. So we, if you experience a microaggression, make sure you heard what they said. Ask them to help you understand what they meant. So in this example, I think what you said was very articulate for a Latina. Is that correct? Can you elaborate what you meant by that, right? So really asking some questions, dig down a little bit deeper. Maybe they misspoke, or maybe they don't even realize how it sounds with what they have actually just said. And so being cognizant of that. And so there's no right or wrong time when to address microaggressions, especially if is it a time where it's a one-on-one conversation? If you're in a meeting and you experience a microaggression, is it a teachable moment? Or, if you become an active bystander, is that the time to chime in? And so I think, oftentimes I tell people that a really great answer, because you have to know the dynamics of individuals in the room. But wanting to move to become an active bystander, that's speaking up. So share your own experiences, how you may have recognized the microaggression, you challenge perhaps an underlying stereotype. We want people to feel a little less self-conscious. We don't want them to be defensive, have them shut down, right? You can offer some language like, I overheard you make the comment that Alicia was very articulate. I used to think that too, but I realized that not everyone from Hispanic or Latin descent are Spanish-speaking individuals, right? So there's some different ways that you can practice this and think about how you might be able to have those discussions with individuals and really work to move past microaggressions. Again, those are some some more around race. When you think about patients and individuals, right? Again, we can associate racial identity and the work. There was a number of examples where individuals who were a doctor who were questioned, right? So again, that micro invalidation of a Black African-American doctor, a Hispanic Latino doctor, regardless of gender, right? Looking specifically around race, who was questioned, are you really a medical provider? Are you really a doctor? And questioning their credentials. And so we have to be very mindful when we are leaders in the community and what those messages send, not only to the patients, but also to the medical providers in whatever capacity. So I know many of you work in public health and other capacities, and you might also be experiencing microaggressions, because we certainly all can experience microaggressions. So for the sake of time, unfortunately, we're going to have to skip our breakout session, but I just wanted you to practice utilizing some of that language. It seems pretty elementary, but of course, when you're in that situation and you either experience a microaggression or you see a microaggression, it's not always as easy to just chime in and you find the right language. And so you'll have a copy of this presentation, which will allow you to have some of that language and be able to practice. You might utilize this in a staff retreat or with your other employees. So again, some other ways to acknowledge your bias. Invite dialogue where there are signs that it might be necessary, right? So again, thinking about how someone might react. It respects the emotional risk and vulnerability it takes for someone to share the impact. And then again, I said this before, we all commit microaggressions. We have to take ownership and have a commitment to grow, right? So an apology goes a long way. Oftentimes I work with college students and I joke and I say they have Twitter fingers because they're quick to go to social media to handle their problems, but they won't have a conversation face-to-face. And I feel like because we've been in this virtual world for the last 12, 18 months, we've lost the ability to really be able to communicate person to person. And so I think that is really the best way to be able to engage in a conversation and acknowledge the impact microaggressions have on someone. So I want to move to call to action, right? I've given you some great strategies. You've amassed a significant amount of information, but want you to really think about, right, how do you move forward with all this information? The work happens after you leave today. So check your mindset, empathy level, do deliberate reflection. So before you encounter anything that's likely to affect bias, so evaluations, if you're writing letters of recommendation, patient encounters, committee decisions, right? You want to be very deliberate in your reflection so that it can help you recognize your potential for bias and correct it before it even happens. Right, we did a really quick mindfulness technique, but we want to make sure that we are clear and present and focused and slow down when we make decisions and minimize distractions as much as possible. Examine your thoughts, question your potential bias in that thought process. So some different strategies around debiasing that have come up quite a bit this afternoon, right? Thinking about what is that, recognize and be aware of your trigger, assess your bias that we talked about. Like, where did it come from? Why am I thinking about this? Take time to deconstruct and relearn, right? It's not going to happen overnight, but certainly we have to be very mindful. And even the best intended individuals, right, can support a community, right? Someone said, I work in public health. That doesn't mean that you still don't have bias. And so just being mindful of that. Get proximate. If any of you are familiar with Brian Stevenson, he's done a significant amount of work with criminal justice reform, right? Get proximate to the communities that you're serving. If you're not engaging with the people that you're working with and serving, if your individuals that you surround yourself with don't reflect those communities, how do you know how best to serve them and understand how to best move forward and again, debias? Continue ongoing workshop training, books. You can curate your TED Talks on specific topics to be able to continue the dialogue, right? If you just come today and don't do anything else, right, you have to continue to learn and grow to be able to move forward when it comes to this work. Be mindful of cultural norms in the organizations you work with. Again, educate those that commit microaggressions. It's not on the marginalized groups to educate the majority. So someone, you might be engaging, you commit a microaggression, that person it is not on them to educate you on why it was a microaggression. How can you continue to educate yourself? Intent versus impact. I want to specifically call this one out, right? We want to focus on the impact on the recipient, regardless of the intent of the offending behavior. Again, thinking if it was unconscious or not. And I say, if an elephant stands on your foot, it hurts, right? Regardless of the intent of that elephant. So really thinking about how do you work towards being an organization that reflects the population that you serve. When you look at implicit bias, microaggression, prejudice, stereotypes, right, it plays a huge role in the persistent healthcare disparities among marginalized, minoritized communities because we have to recruit more physicians of color from underrepresented communities to reduce these disparities. We have to recruit and retain physicians of color, right? So all of these things are at play and impact the care that individuals are giving. And so it's not to say, though, that only an underrepresented individual, like a person of color, can only serve a person of color, right? We have to be very mindful, but there certainly is a lack of representation when we think about the healthcare field in certain aspects anyway, and being mindful of that. Think again about being aware of your biases. We talked about that, right? Just want to reinforce that point. Don't tokenize. We talked about that. I've had an opportunity to work with a medical school that is looking to diversify their applicant pool, right? They have a student that they were utilizing primarily as their spokesperson for underrepresented communities. That doesn't work, right? They can't speak for all people of color. They can't speak for, right, Black, African American, Latinx, AO, right? There are lots of things, right? They can only speak on their experience in the medical school. We have to be cognizant there are many issues around us that are happening. So we have to be aware, right? COVID-19, LGBTQ rights, Black, all lives, Blue Lives Matter, Back to Blue, religious discrimination, travel bans, DACA, the Deferred Action for Childhood Arrivals, the Me Too movement, immigration, freedom of speech. I'm exhausted just saying that list. And I say that slightly, humorous, but the reality is many of these things are impacting people. We think about the microaggressions and the impact that it has on health disparities and the impact of individuals for minoritized and marginalized communities. These are all things that impact how they show up and how they're engaging whether it's within healthcare or what have you. And so we have to be mindful. It's not to say you have to know everything and all of those issues, but it's important to be cognizant of how it's impacting the communities that you're directly serving and working with. So again, I said you've amassed a significant amount of information. I challenge you to think about these 4 questions as you move forward with the information and how you work to work on anti-bias or unconscious bias and microaggressions. Think of your organization or the sphere of influence you have. How can your organization be actively anti-bias by design? What are you committed to doing to ensuring that you are not using microaggressions? And how can you educate or influence others with the information that you've learned today or that you continue to educate yourself? And then, right, you have to have that commitment. So what is your commitment? What must you do to succeed? I always say I'm going to do X, Y, or Z. We think of New Year's resolutions and, those end of February at best. And so perhaps there's someone in the breakout session that you joined today that, you can follow up with, or there might be another person on this call and you can say, this is what I want to do with the information. This is how I'm going to move forward. Can we do a 30-day check-in, right? It could be that simple to just see what you're doing. And it doesn't have to be, right, eradicating racism, right? It could literally be how you're sharing this information. You are utilizing some of the exercises in the beginning of this to talk about implicit bias. So there's low-hanging fruit things that you can certainly do to share the information with other individuals. And then I always like to end with a quote. Invite people into your life that don't look or act like you. You might find they challenge your assumptions and make you grow. And so this is from Melody Hobson, the co-CEO and president of Ariel Investments. She's also married to George Lucas. And so in many of her interviews and talks, she says that she's Yoda's mom. So if you are a Star Wars fan or Mandalorian, there's no shortage of things out there. But very dynamic woman. A very impressive resume, but that quote just really resonates and I think speaks to the work that we do with communities and how we engage and learn from other individuals to help break down maybe those implicit biases that we have or some of those conscious biases that we're realizing we do have as well. A couple of books for you if you'd like to read. There are 6 different ones here that I offer. Again, you will get the PowerPoint slides, and so those will be able to see those books. Perhaps you've read some of them. There's no shortage of resources. One of the other tools that I failed to list on the resource guide is there is an implicit association test that has come out of Harvard University. So if you're looking at, I want to learn a little bit more about my own implicit bias and the association, you can certainly look at those and take those assessments to see. There's one that has the race and racism association implicit bias test. There's been a significant amount of research and work done within that. So you can look at white and black when you look at preferences and associations, right? It's more to bring it front of mind. And so thinking about then you're aware of that. So then how do you work on de-biasing and how do you continue to educate yourself on those different communities? Let's see here, I'm going to check the chat and make sure if there are. I lost the chat. I saw a couple things pop up in here. It was blinking on me, but I'll come to that in just a second. And then, of course, all of my references and resources from the presentation today. There is a significant amount of literature. I know this is teeny tiny because there's so much. There's actually 2 slides here, but some great things if you want to do a little deeper dive in some of the research and information that's out there. And then here is some contact information for me in the Office of Diversity and Inclusion. Certainly, if you have follow-up questions, my email's on the next slide. Follow us. We provide a lot of education and awareness. We try to make sure that we're covering the gamut when it comes to diversity, inclusion, and equity. So if you are interested in following us, all of our contact information. And if you're in Wichita, feel free to stop by and see me in the Radigan Student Center on campus. And there is my email contact information. I do appreciate your time this afternoon. I know we covered a lot. We went at a pace that was probably faster than what I normally like to go, but we had a lot of information to cover. And so in the next couple of minutes, I want to open it up for any questions or comments that you might have. So I'll see if anyone has anything or if there was anything else in the chat. Looks like there was some great discussion on here.
Usually if I want to save the chats, then I have the ability to do so. So Laura, hopefully you'll save some of those and just include them in a document or something, because the chat was on point. Everyone was very reactive in there and I loved reading it. And your presentation, I could listen to you all day. Thank you.
No, thank you.
So with that, Alicia, thank you again for such an engaging presentation, a lot of information to really think about and come back to move forward in this work. As shared in the chat, you can connect with Alicia further on email and Twitter. Thank you for attending the Sizzling Summer Series session number 2. Please join us on July 15th at 10 a.m. for session number 3. The topic will be structural versus individual inequities. A link to the registration page for session number 3 is being placed in the chat box right now. And we thank you in advance for completing the evaluation for this session. That will be sent to you in the next 24 hours. And from all of us at the Midwestern Public Health Training Center, see you on July 15th. And thank you again, Alicia, for a wonderful session.
Thank you, everyone.